Good morning. It's July 10th and another warm day, but not hot as it's been. We'll call this morning session to order. It's a work session to begin with on the overview of available opioid data. And Dr. Melnick, I don't see you on, but are you on?
Yes, I'm on. I'm here. Can you see me now?
Yes, thank you. Go ahead.
For the record, Dr. Alan Melnick, I'm Public Health Director and Health Officer. So this is the first of our two meetings at the Board of Health this month. And later this month, we're going to have a pretty detailed presentation on drug overdose trends in our county. And we'll be looking at at the end of the month at overdose death trends for the county, review the substances involved in the overdose deaths, as well as, besides deaths, we'll be looking at other indicators of opioid use disorder, including a drug use disorder, including emergency department visits and emergency medical services responses. We'll be sharing the substance use, morbidity, and mortality data trends and some preliminary 2023 overdose death data. And but the 2023 death data won't be finalized until later this year. So what we're going to do at the end of the month is focus on a review of data. We want to show you the landscape of drug overdoses in Clark County. So this month is going to be all about data. Today, I'm going to take a few minutes to discuss describe the overdose and death data. I'm not going to give you results today. I'm going to be describing the data, including its limitations, and also point to where it's the information is available on our website, as well as the different data sets we use. Later this month, we'll have a bunch more at our longer Board of Health meeting. We'll have a much deeper look at the data itself. In future presentations later this year, once we get the understanding of the data this month, later this year we'll be presenting to you with our community partners about what public health and our community partners are doing around substance use prevention and treatment. So we just wanted to give you a foundation of the data today, just a description of the different data sets and what they measure and their limitations. And then later in the month, in 3 weeks, we'll be actually presenting the data. In between now and then, I want to also point you to the Clark County Overdose Dashboard on our website. So if you go on the Clark County website and go to our department and go to assessments and data section of our website, so if you look under community data, you will see a link to the the Clark County Overdose Dashboard. It's not just limited to opioids, so I want to make sure it's the Clark County Overdose Dashboard. The dashboard uses data from systems that are maintained by the State Department of Health, including death certificate data and the state prescription monitoring program. I want to point out that the death statistics are not finalized, typically not finalized until the end of the calendar year after the reporting year. So that means that the 2023 death data should not be finalized until the end of this year. We have some preliminary 2023 data that we've added to the dashboard, but those numbers can change as the data is finalized over the next several months. I know questions have come up about this before about, why does it take so long for the death data to be completed? Well, I'll give you at least a couple of reasons. One is that it takes time for the death certificates and data to be finalized. Some causes and manner of death may be pending toxicology results that can take 3 to 6 months to return. And then the State Department of Health really has to reconcile and review the data for accuracy. Also, The state death certificate data, the completed death certificate data is based on residents. They're based on Clark County residents. So regardless of where the death occurred. So if a Clark County resident died in another county, another state, or another country, that data has to get into the Clark County death data eventually, but you could see how that might take some time to gather and reconcile and check that data. So, but on the other hand, because it is as complete as possible, as I've described, it is the most complete. The death certificate data is the most complete picture of the causes and manners of death among Clark County residents. So even though there's delay, the benefit is that it's the most accurate, a complete picture of causes and manners of death for our residents. On the dashboard, we have a snapshot of overdoses in Clark County. So we've got some examples of what we have is we've got the number of overdose deaths for each of the last 5 years, which can be broken up by substance. So you can search by a specific drug. We have the number of hospitalizations for overdose, the number of EMS responses related to drug overdose, and the number of Clark County residents prescribed opioids and death rates by zip code. The dashboard also has trends by substance or drug type for Clark County and Washington State. And then it has overdose death demographics. So that would be data by age, sex, and race and ethnicity, and by substance or drug type, and non-fatal overdose hospitalizations by age and sex. We also utilize data systems managed by the state for emergency department hospitalization and EMS data, and that's on our dashboard as well. So I just want to, as you'll, spend time over the next few weeks, hopefully if you have some time to look at the dashboard, I just want to mention some of the limitations of the data. So, for example, the emergency medical services data reflects the number of EMS unit response to a suspected overdose incident. So there can be duplicates. If you can imagine if a couple of EMS units responded and they both reported, that could result in duplication. The hospital data, the hospitalization data is based on the diagnosis codes used when the person was discharged. People discharged, Clark County residents discharged from out-of-state hospitals, rehab centers, federal hospitals, and psychiatric hospitals wouldn't be included, nor would people who died during their hospitalization. The emergency department data is based on information included in emergency department records for each visit. As a result, the accuracy depends on the completeness and details of the records. Some visits for overdoses might be missed. Others may be misclassified as an overdose. And overdose visits to the emergency department are considered suspected due to the unavailability of clinical laboratory confirmation at the time of the visit. I want to also mention the physician prescription monitoring data. Records of, so, we look at the numbers of prescriptions written for opioids, for example. The records of prescriptions dispensed outside of Washington State, prescribed for less than or equal to 24 hours, administered or given to a patient in the hospital, and dispensed from a Department of Corrections pharmacy unless the offender is released with a prescription from prescriptions opioid treatment programs in some federally operated pharmacies are not collected. So as I went through this long list, but there's a list of locations and situations where the opioid prescriptions would not be listed in the database. So that's, well, these are still all valuable tools. There are some limitations to this. So as long as we consider these limitations looking at the data, we actually take these different pieces of information and piece them together to get a better understanding of what's going on in our community. I want to briefly mention medical examiner data. We also have data available on our Clark County Medical Examiner's Office website. And the medical examiner's office produces annual reports with data about jurisdictional deaths investigated by the MEO, with the data broken out by cause and manner of death. And the last 10 years of reports are on the About section. The medical examiner's office does not collect or report data for deaths of Clark County residents occurring outside of our jurisdiction, such as other counties, states, or countries. The MEO investigates the circumstances of death reported to the office to determine jurisdictional authority. Natural deaths are not under the jurisdiction of the medical examiner, and natural death causes are not included as part of the jurisdictional reporting. The annual reports are issued about 6 months after the end of the reporting year. And the office published the 2023 report last week, and it is now posted on our website. So while the data is a little more timely, I'm just pointing out that compared to the death certificate data, these reports are specific to a portion of the deaths that occur in Clark County. In 2023, drug-related accidental deaths accounted for 45% of accidental deaths investigated by the office. That was a leading cause of accidental deaths in Clark County. Elderly falls was the second cause at 31%. And the annual report also includes the data on the substances involved in the 172 drug-related accidental deaths. So that's there in the report as well. So just to wrap up, I know I've been a little long-winded here. Be happy to answer questions. I just want to mention that the overdose dashboard and the medical examiner's office annual reports are just two sets of data we provide on our website. We look, there's a lot of other data on our website besides these, and feel free to look around. We also look forward to taking a closer look at the overdose data. We'll actually be talking about the data at the meeting later this month. And then, as I mentioned earlier, over the coming months, we'll be actually meeting with you to discuss what we and our community partners are doing around a drug use disorder prevention, as well as treatment. So that's the long wrap up. I'm happy to answer questions.
Yes, I have one, Dr. Melnick. 2 or 3 weeks ago, the council approved a new methodology for the medical examiner for their office. And I wondered if the implementation of that will make a difference in the rapidity with which you can report the final data for a year.
Yeah, I might defer on this one. I think Andrea Pruitt, who oversees the medical examiner's office, is in the room. She may have an answer to that question.
Good morning, Andrea Pruitt, Community Health Director for the record. Yes, we did have those conversations. The conversations we had regarding the approval for the purchase of a Randox toxicology machine have not formally come before council for approval to purchase the machine. In the event that you do formally approve the purchase of the machine and the other pieces of the package necessary to use it, yes, the machine is designed under conditions where all of the available evidence is present to be able to sign out cases the same day, which would allow us to be able to use another piece of data to inform our rapid response efforts. So yes, that data would be usable related to our efforts for prevention and our community communication efforts.
And Councilor Bowerman, if I can, you did see the staff report, and then Public Health asked to have it removed. So you probably did read it in preparation for our council meeting.
Oh, okay. That's probably it. I had it in my mind that it was already approved. Thank you.
That machine will give us, right now, it can take months for toxicology results from the state lab. And this will enable the medical examiner's office to get results immediately.
Other questions by council? So, Dr. Melnick, I know some of this is art beyond just data collection. And the challenging part of some of this is, whether you know what's in someone's system or not, it's just one fact, one circumstantial evidence. When you parse through what's an intentional suicide versus an accident, that becomes pretty murky with addicts. The term accidentally on purpose comes to mind. They just don't care because they're addicted. And there's no reputable source on the black market for any of these drugs that we're concerned about. There's no reputable market. So it's Russian roulette. If you're not taking a script from your own personal health care provider and getting it from a pharmacy, you are risking your life. And it's that issue, that nexus of what is depression, what is mental health treatment, how do we get to those addicts that really are out of control or just don't care what they may be accidentally overdosing on. I mean, that's where the data kind of leaves us cold as we try to figure out a response to this. New York City and California, I haven't heard anything more about their plans to involuntarily treat addicts, mainly those homeless that just passed out on the street. I understand that they passed the laws over a year ago now, but haven't funded the healthcare system behind it. So, that's where we're all heading eventually in order to really have a dramatic impact on preventing these overdoses, whether they're suicide or accidentally. Do you have any comment on that?
Well, I think that, this month I wanted to give you the background. Today's just a description of the data sets and the limitations of the data. And then we're going to be going over the data itself later this month, much longer session. I think, I wanted to give you all a background about how we measure this and how we look at it, what data is available. And then we really do look forward to having a robust discussion with you over the ensuing months about prevention and treatment. I completely agree. I mean, one of the advantages, by the way, of the Randox machine that Andrea mentioned earlier, is that if because it's real-time data, it'll give us some sort of idea if there's some, for example, new drugs coming into the community, or new deaths due to what's actually circulating in real time. So that'll be helpful. But the bottom line is, we wanted to set the table here this month and then have a more robust discussion with you and community partners about prevention and treatment.
Thank you, Dr. Melnick. So we do have a lot of on our agenda this morning. Are there any other questions on this topic before we move to our fee schedule adjustment proposal by Public Health? Okay, thank you for that presentation. Dr. Melnick, were you going to introduce this next topic?
Yeah.